Dr. Zach is back in the BT studio, and flu season is upon us, and it seems to be a pretty bad one out there. How do you protect yourself and your family? Well, Dr. Zach has some advice. Let's first of all talk about, you must be seeing a lot more people coming into the emergency rooms with the flu. This is a pretty bad one this year, isn't it?
Yeah, I mean, yeah, 'tis the season, definitely. And over the holidays, it was crazy. It was really, really busy at many, if not all, emergency departments. And it's definitely the flu, and it's also other viruses, you know,
Right.
colds and sore throats and other things that aren't the flu, but are sometimes just as bad. And a lot of vomiting and diarrhea and those kind of things, gastroenteritis. So,
it's a bad one.
oh, yeah.
Let's
Keeping
talk
us
about the
busy.
flu shot, because, you know, we talked about it a little bit earlier on this week, the fact that the H3N2, this type A flu, the flu shot's only effective in about 10%. Now, type B, it's effective 60 to 70%.
You got it.
Is it still worth getting the flu shot, and who should get it?
I think so.
Yeah.
So I get it every year, and I certainly think that people should get it. And in fact, I would recommend everyone get it. I mean, you're right. Definitely, the numbers are out there. It's not a very effective flu shot this year. However, it's still better than nothing. And if you
Right.
do get the flu, and especially if you've got it year after year, probably the flu that you're going to get is less severe than the one you would get if
Okay.
you didn't have the shot. Now, who should definitely get it? Seniors, people with chronic diseases, so diabetes, COPD, liver disease, kidney disease, anyone who is immunosuppressed. You know, down at the Vic, we see a lot of transplant patients and cancer
Right.
patients who are on chemotherapy. Those people for sure, right, because they're more susceptible to any kind of infection, and when they get an infection, it can be more dangerous.
And when some people get it, unfortunately, they still end up going to work, right? And even in the
Oh,
early
yeah.
stages, you may feel okay and you go to work. Let's talk about some of the danger zones at the workplace that you should be careful of.
Yeah. So that's one thing, just to repeat what you're saying is, if you're sick, don't go to work.
Yeah.
Okay? Like, I mean, you really want to keep it to yourself. You don't want to spread it with everyone else. And I understand work ethic and you want to work, but the problem is you're very infectious as soon as you get the flu, and then for a good week after. So
Okay.
the danger zones, unfortunately, danger zones are everywhere, right? Like, so if someone is coughing or sneezing, and one of the stats people like is sneezes can actually travel, the droplets from sneezes can travel up to 20 feet.
That's
Or more,
unbelievable.
actually up to 25 feet, like 8 meters.
And a cough is
cough
what,
is
like 20 or
3
something?
meters, which is
Okay.
like 18 or so feet. So it's a long way, right?
Yeah.
And the droplets can actually hang out in the air for a while, especially part of the reason the virus is bad, like so many people get the flu and other viruses in the winter, is viruses like cool, dry air.
Right.
And so that's the air in the winter.
That's where we get catching a cold, you know, in the cold. You're not necessarily catching it,
Yeah.
but once it gets in you, it kind of incubates in there, right?
Absolutely. And we're all staying indoors for the most part, right? We're all in the buses and whatever. We
Mm-hmm.
don't walk as much. We're not in the outdoors. So if we cough or sneeze, we're in this enclosed space and we can all catch it. So, and then the other thing is, because if it's in like a droplet, if it's in like mucus, it lasts longer and it can travel longer. So anyway, and if it's not, if it's really dry air, it can actually stay in the air. The droplets can actually bring it
You know,
down
you're
to the
just
floor.
scaring everybody
Sorry.
at home right now. No, but
Anyway.
it's something to think about.
But
Well, let's
basically,
talk about like things like for
surfaces.
instance, like the doorknob.
Yeah.
Right?
So-
I mean, that must be one of the worst.
Yeah, so surfaces are the worst because, yes,
Right.
sometimes the tiny little droplets can stay in the air, but for the most part, if it's a droplet, if there's some moisture, it'll fall to the ground. But anything that people are touching currently, so we talked about doorknobs for sure. I mean, one of the things that people always say is doorknobs are worse in terms of amount of germs than toilet seats. That gives people, they're like, really? But yes, absolutely.
it's true,
Yeah,
yeah.
But the other things people don't think about, and we were talking before, is your cell phone, right? Your mobile phone, your
As soon
mobile
as you
device.
said that to me, I just
your
realized.
computer, like everything. How often do we clean those things?
Yeah.
And there are tons and tons of germs, bacteria, viruses on these things when we swab them. Actually, my kid just did a science experiment with swabbing these different surfaces. and
Really?
it's quite disgusting. However, keep in mind that not all viruses and bacteria are bad, right? We're constantly bombarded with
Right.
things, but the flu is one of the ones that can make us very sick. So we have to be more careful for that one.
Yeah, because when we were talking about the cell phone, I just realized, you know, you're touching all these things, you're swiping on your cell phone, then you're putting it against your face.
Right up next
I mean,
to your-
nothing I would have thought about. Elevators, probably
Well,
another
elevator
big
buttons,
one,
yeah.
right?
I think they say it's like 40 times, like elevator buttons have something like 40 times more germs than a toilet seat. So one of the things we were talking about before also is that, you know, that the liquid hand sanitizer that
Yeah.
you don't need water for. That's great. Those wipes that you can use for surfaces are great too. The main thing is to be cognizant of the fact of the things that you're touching, you know. So some people don't touch doorknobs, you know. They use their elbow, or if it's an outgoing door, yeah, they'll use their elbow.
Yeah.
But if you are touching, we all have to touch a doorknob sometimes. We all have to touch computers. But use that hand sanitizer or use something to clean it off. And if you don't, just be careful not to bring, if you think your hands may have some germs on them, don't touch your eye, don't touch your nose, don't, pick your tooth, that sort of thing, because that's a great way to introduce the virus into you.
Always great advice. There's actually more information, but as usual, we're going to send people to our website. If you go to btmontreal.ca, click on our blog section. Dr. Zach is always kind enough to give us a full list of everything that he talks about each and every segment. Don't go away. We'll be back with more Breakfast Television coming up after this.